Hi, Kevin Henry, the Group Editorial Director for Advanced Star and Dental Products Report, and I'm on a Google Hangout this afternoon with my friend Dr. Mike DiTolla. Mike, how are you?
I'm good, Kevin. How you doing today?
Hey, doing good, man. Good to see you. You and I have worked together for a number of years now, for those viewers who don't know you, Mike, would you just take a minute and kind of introduce yourself?
Well, I've been at a dental school now for 26 years, I think it was, and 13 years ago, I had the opportunity to make some educational DVDs with Glidewell Laboratories, which was just about 10 or 15 minutes away from where I practice, and I ended up doing more and more with them, and eventually moved my practice inside of Glidewell Laboratories, and that's where I've been for the last 13 years, and it's given me a really interesting look at the crown and bridge habits of American dentists.
You and I have had numerous talks about that, and I always enjoy your insight into that. And part of what we're going to talk about today is some of the things that you've seen working with the KaVo MASTERtorque handpiece. I know that there's a webinar and an ebook surrounding that, and just kind of wanted to get your overall impressions about why you were so interested in this handpiece.
Well, I've been using KaVo handpieces for probably the last 12 or 13 years, and when I started at the laboratory, I noticed that, like most dentists, I really struggled at times to be able to polish restorations once we had adjusted them intraorally. And I noticed that at the laboratory, every technician used an electric handpiece to polish these restorations. So I got some KaVo electric handpieces and realized all of a sudden, wow, I can actually polish these restorations now, but the handpiece was bigger than what I was used to. It was a little heavier than what I was used to, certainly as well. But I was able to still use it and get it in most areas, even though the head was a little bit bigger than a traditional handpiece. But then recently, about a year ago, I hired a female associate to work with me, a dentist with much smaller hands, and it was a little much for her, the electric handpiece. And so when the MASTERtorque came out, their new air rotor, I got a couple for her, and while she was on vacation recently, I went and stole one from her a couple months ago to get a second molar on a patient who just couldn't open wide enough for the electric handpiece. And I forgot how many things that I love about an air rotor handpiece like that. In that case, it was the nice small head that I could get back and get onto the second molar without having to use some sort of jack to pry the patient's mouth open and dislocate her TMJ. And I forgot just how light, the nice feel of an air rotor, and that ability to really squeeze into the back, and that got me excited again. I thought, wow, I went too far the other direction, and now I'm somebody who has electric handpieces for when I need them, and an air rotor like the MASTERtorque for where I need that. And there's really no reason not to have both.
You and I were talking a little bit before we came on air about how much zirconia is being used now in Emacs and things like that. How does the air rotor handpiece work with materials such as that?
That was initially one of my concerns because electric handpieces, regardless of what speed they're going, they have an amazing amount of torque. And so no matter how hard you push the burr against a tooth or against a high-strength all-ceramic crown like Emacs or like Bruxer, the burr keeps spinning because there's so much torque. So I was a little bit concerned about the air rotor, that it wouldn't maybe have the power that I was used to, but the MASTERtorque actually tests out at 23 watts of peak power, and that's pretty amazing for a small little air rotor like that. And so to my surprise, I actually videotaped myself the other day cutting off some Emacs crowns and some zirconia crowns with this handpiece, because I did want to prove to myself that it would be able to handle these situations. Now, hopefully I'm not cutting off my own crowns that often, but sometimes it's going to be crowns from other dentists, and you just want to know that you're able to do this with this handpiece and that it's got that kind of versatility. 7 out of 10 people that I know when I talk to dentists still use air rotors. Only about 30% have gone to electrics. So a step forward like this with the MASTERtorque handpiece really is good news for the majority of dentists who are still using air rotor handpieces.
And one of the things that you talk about in the ebook is that the noise, that whine that we always hear from the handpiece, and how the dental patients just, it drives them crazy, and it's one of the things that they fear the most about going to the dentist. talk a little bit about the reduced noise that you get with this KaVo Mastertorque as well.
Well, I remember when I switched from my original air rotor handpieces, which weren't KaVo, to the KaVo electric handpieces 13 years ago. One of the things I noticed was that there was a reduction, not only in the overall volume, but just in that tooth grinding kind of pitch of that sound that just elicits fear in almost every human on the planet. And I liked that it got quieter, and so when I went and borrowed my associate's Mastertorque, I was a little worried because I'd always associated that high-pitched, terrifying whine with air rotors, and I was surprised to see that it was not that same experience that my old air rotor was. In fact, it might be quieter than my electric handpiece, and the pitch is not that nerve-grating kind of whine. And I asked them about it. I asked KaVo about it, and as you would expect, they've got their own kind of proprietary ball bearing technology so that as the turbine's spinning, you don't get these harmonic vibrations that come out of there. And it's vibration free physically too, so you don't get any sounds from that as well. So, ideally one day, hopefully we'll have a handpiece, whether it's an air rotor or electric, that's absolutely quiet, that you can't hear at all. I don't know when that'll happen, but I'm guessing that being the German company and committed to perfection and excellence like they are, that'll probably come from KaVo, and I'm sure patients will celebrate in the streets when we finally have a handpiece where you don't have to listen to that sound anymore.
Amen. Absolutely. And last question for you. I know one of the things that you've also been very impressed with is the stopping time. Could you just kind of elaborate on that?
Well, like I said, I borrowed this while my associate was on vacation a couple months ago, and it was on a woman, and I was prepping an upper second molar, and her cheek was it was not skinny, might be one way to put it, but she didn't have a buccal fat pad. There's a thing called the buccal. It was like a buccal fat mattress. I mean, it was huge. So I had this Minnesota retractor trying to hold her cheek back, but as she opened farther, the coronoid process came farther, and it would push this soft tissue right into where I was working on the buccal, and at one point I just kind of lost control over it, and it's happened to every dentist who preps one of these upper second molars on a patient who might be, slightly overweight, and by that I mean about 150 pounds. And so as I came around on the buccal, the burr got caught in the cheek, and usually it takes your brain a tenth of a second or two to recognize it. When I took my foot off the rheostat, it stopped nearly immediately, I mean within a second, and I've done some damage before in cheeks where you take your foot off and it's still spinning and it gets sucked up into the cheek. And so the stopping power, that's one big thing, is for avoiding injuries like that, be it a tongue or a cheek, which hopefully doesn't happen, but we all know it does. Maybe it's even an adjacent tooth where you can just take your foot off and have it kind of stop on a dime, which is nice. But the other thing that's more of kind of an infection control issue is that when you take your foot off the rheostat, as it's usually slowing down on its own and backing off the power, it has a tendency to suck in aerosol from the outside or saliva from the patient's mouth. And because it stops so quickly, there's much less of that going on, and that's a nice feature as well.
Certainly want to encourage our viewers to read the ebook and check out the webinar from Dr. DiTolla, where he's going to expound on some of the things that he's been talking about in this interview with me. And Mike, as always, I enjoy catching up with you. Thanks so much for your time, man. I appreciate it.
Thank you, Kevin. That was painless, and I look forward to getting the opportunity to do another one with you soon.
Sounds good. Take care, my friend.